South Africa is playing an important role in what could be one of the most momentous scientific breakthroughs in history. President Cyril Ramaphosa has hailed the country's research initiatives in the development of possible preventative treatment or vaccine for the virus. He's called for continental and international collaboration in doing so.
South Africa is participating in several research initiatives. We must ensure that there is equitable access to medical equipment, technologies, in all respects. In this final decade towards the attainment of the Sustainable Development Goals, we must press ahead with our goal of making universal healthcare a reality for all the people of the world.
TASC, a self-funded organization for clinical trials, has injected its first healthcare worker with BCG, a vaccine used to treat tuberculosis in children. A minimum of 500 healthcare workers have been invited to participate in the clinical trials. Their reaction to the drug will be closely monitored, and if there is a robust enough positive signal, the results will be made public.
There have been indications that the vaccine might be doing more than just protecting children from severe forms of TB. There have been reports about various protective effects that this vaccine can have, and studying all this evidence, we have thought that it might actually work for COVID-19, but obviously there is no data for it. So we are doing this trial, and we have decided to offer this to people that are particularly exposed to risk, which at the moment is healthcare workers in the big hospitals. And we are inviting them to be vaccinated either with this vaccine or a placebo. And then over the next 12 months, we will follow both of these groups and see if those that receive the vaccination perhaps do better during the epidemic. If our study suddenly showed evidence that everyone at risk of COVID-19 should be vaccinated, we need to be very conscious about the stock of this vaccine and the production that would have to be increased. It is not an expensive product. I think it's between 10 and 20 rands a vaccine, so there is certainly not a huge commercial interest in it. There would be a public health interest in it mainly.
Although clinical trials are underway in South Africa, it may take up to 18 months before a vaccine is developed. Even then, there are some clinical protocols that first need to be observed.
There are something like about 5 or 6 clinical trials in South Africa underway right now. One is of a BCG vaccine in healthcare workers. There are 1 or 2 trials of chloroquine or hydroxychloroquine. And there's the big WHO Solidarity trial. That is a 5-arm trial that's being done in many countries, including South Africa. So those are among the trials I am aware of. I know that discussions are underway by several groups to look at participating in yet more international clinical trials. I have not, at this stage, seen trials that are purely South African and are completely new ideas. I guess closest it comes to is the BCG trial, but that's not new. Actually, that's being done in Australia. So I don't think we've really seen that. But I think, I keep saying to everyone, you have to understand, we've only known about this virus, for 4 or 5 months.
While scientists work tirelessly to make a COVID-19 vaccine available in the near future, the reality is it may take years for a cure to be found. In the meantime, we're urged to wash our hands, sanitize consistently, and maintain social distancing. Nothando Makutulela, SABC News, Johannesburg.